Hey everyone, in this video we are going to talk about what is a troponin test and why it is performed, and these will be the contents. We are going to discuss what is troponin, the troponin test, normal troponin level, interpretation of results, high sensitivity cardiac troponin, and what other tests could also be performed with this test. So first of all, what is troponin? Troponin is basically a protein that is found in the muscles of the heart, and it is complex of three regulatory proteins: the troponin C, troponin I, and the troponin T, and these are all integral to muscle contraction. The troponins I and T, they are the only ones of the interest in the cardiology and will be released in the blood if the heart has suffered damage. So, the presence of these troponins is normally undetectable in the blood. Physicians often associate the troponin with the heart attacks, and they are widely used as diagnostic and prognostic indicators in the management of the myocardial infarction and acute coronary syndrome. It is measured using a simple blood sample. Then here again you can see this is a figure which is showing you the structure of the troponin and where it is present. So it is basically for the purpose of the contraction of the muscle. And as I've told you that the troponins I, they are very much specific to the heart. They are not normally present in the blood, but if there is damage to the heart, only then these troponin molecules they are released into the blood, and that is why you can see why the troponins I are raised into the blood when the person gets myocardial infarction. Now the troponin test. In general, there are no special preparations to make before the analysis. It is a blood test that can be done at any time and doesn't require the fasting, except whether your blood sample will be used for the further testing. Recheck troponin levels one or more times over a 24-hour period to look for changing levels over time may be needed for the persons or the patients who are being evaluated for the heart attack. Then in this figure you can see this is the Ecclesi's troponin TSA, and it is used to measure the troponin T levels. It is used in the hospital labs and it is fully on demand and provide the results very quickly within 9 minutes. Then the normal value of the troponin. Laboratories measure the amount of the troponin proteins in your blood, and the results of the analysis they are expressed in the nanograms per ml or the nanograms per liter. Although the normal troponin levels they vary from lab to lab, it is generally accepted that the normal value is below 0.04 nanogram per ml. So it means the normal is from 0 to 0.04 nanograms per ml. And if the result is between the 0.04 to 0.39, for example, 0.39 nanograms per ml, so this often indicates that there is a heart problem. So it is important to see a doctor to look for the other symptoms and or the other test before making diagnosis. So what we can say, generally it is accepted that if there is the levels of the troponin above 0.4 nanogram per ml, so it is high. And what is to be noticed that the reference value for the troponin test varies by lab and the type of test performed. So you should consult your doctor to discuss this. Then the result interpretation. So even a low level of the troponin is detected in your blood, and it may mean that your heart is damaged. The increase in troponin occurs approximately 4 to 6 or somewhere 4 to 8 hours after the onset of pain. So it is important to know that having this test too soon after a heart attack can result in a false negative. Yes, because it is raising after 4 to 8 hours, right? So it means that before that period, if you are making your or if you are getting your test done, it means that you are going to have the false negative test, and the elevated levels of the troponin can persist for up to 10 to 14 days after the cardiac damage. An increase in the serum troponin is almost always indicative of the cardiac involvement. So a very large elevation is usually suggestive of an acute myocardial infarction. Now there can be other reasons as well for the higher than normal troponin levels, and these reasons can be like because of the kidney failure or the chronic kidney disease. Pulmonary embolism can also have an indirect effect on the heart, and a traumatic injury to the heart such as the sudden heart blow to the chest, the toxic damage, the cardiotoxic chemotherapy or the drug intoxication, etc., severe COVID-19, sepsis, severe arrhythmia, severe anemia. So these can all be the cause of, you can say, the damage to the heart, and these can also raise the troponin levels. So the test results may vary depending on your age, gender, medical history, test method used, and the other factors. The doctor may look at or look for the other symptoms and order the other tests before making a diagnosis. Then the high sensitivity cardiac troponin. So several generations of the troponin test have been developed to provide more accurate and the reliable results of the troponin blood test for the faster and the more accurate detection of the heart attacks. But the high sensitivity cardiac troponin is a newer type of the test, and this can detect the lower levels of the troponin, and this can help diagnose the heart damage and the acute coronary syndrome earlier. Then we have other tests as well that can be performed. Though we know that the troponin test is typical to the heart, but these tests can also be performed like the ECG or the echocardiogram, determination of the creatinine kinase CPK and the creatinine kinase MB. Myoglobin assay can also be done. As you know that the myoglobin is raised immediately after the myocardial infarction, so that can be much helpful when the troponins level are not increased, after the myocardial infarction immediately, as you know that it takes about 4 to 6 hours to raise in the blood. So the myoglobin assays can be performed, or the copeptin test can also be performed. So that was all about the troponin test. I hope you got that. So as always, until next time.